Hi, Dr. Jerome Fryer here of Dynamic Disc Designs. One of the concepts that patients often have a hard time understanding is the concept of creep. No, it's not me, or I hope it's not me, but creep is a change in position of a joint. So picture a bone and a bone. Change in position over a constant load. So how much the joint actually moves out of alignment when certain forces are applied. Now with the dynamic disc model, we can demonstrate things that represent where often pain triggers or pain generators are found, which are at the end of the ranges of motion. In this paper here, Solomonov, in 2012, in Journal of Electromyography and Kinesiology, he recorded these changes. Don't get too confused by the graph, but this here, up, and then there's a relaxation period, and then another force is applied and relaxation period. You can see the difference from here to here is the change in the position of the two bones. So these are under different circumstances. So different forces at different times represented here, and you can see the difference in the change, and this is percentage change, how much the joint changed over time. You can connect with me in the description below. Just contact me, and I can share this paper with you. But now with the dynamic disc model, you can get patients to quickly understand what it means under in this case, he measured flexion. So different sustained loads. So as the tissue, I'll give you an example, as the tissue is deformed forward under a certain load and then released and then applied again, there is a slow change in the positioning of the alignment between the two bones. And I think the important part here is to get patients to understand the relaxation period. So under certain end range loads, you can see that the facets actually will change orientation respectively. All right? So creating mindset about recovery, what does recovery look like, I think is a great strategy in helping patients understand. So what I mean by recovery is that at the end range, it's good to give the tissues a chance to recover back to neutral. If you continue to flex load, it could be extension load, it could be lateral bending load, it doesn't matter. It's about existing on the end, like kind of living on the edge of the joint anatomical range of motion. For example, I had a patient yesterday that came in and said, you know, it only hurts when I come up from bending forward. So what I believe is going on, and I said, well, is it worse when you maintain forward bending for an extended period of time? She had worked with children. She works with children, so she's in that kind of constant flexion state because they're shorter. What I believe is very likely is going on is that when she goes into flexion, there is an anterior translation of L4 on L5. So when she comes back up, of course, there's going to be more shear stress on the facet joint, so she feels the facets approximating as she kind of stands up. I also went and did an assessment, simple assessment, posterior and anterior translation when she was lying on her stomach, and there was confirmation that very likely there was facetogenic pain. So in any event, coming back to it, these models, because they're dynamic, can now help patients clearly understand what creep means. And there's another term called hysteresis, which is the change under a constant load, the difference between the distance the bone travels. So anyways, just wanted to highlight this with the model, and also if anybody's interested, they can contact me directly and I can get you the paper. Take care.